So I'm gonna tell you about what is ventricular assist device and how it helps, what are the advantages and disadvantages. So ventricular assist device is basically a pump which supports the heart. When your heart is weak, it's not giving enough blood. Like when your coronaries are diseased, you go for stenting or bypass surgery. When your valves are diseased, you go for valve replacement or repair. When your pump is not working, then you need to go for either ventricular assist device or heart transplant. So when the function of the ventricular assist device is when we attach it to the ventricle, it takes the blood from the ventricle and gives to the aorta. So it replaces the ventricle. And whether your heart is working or not, this keeps on working. The advantages are it's going to prolong your life, otherwise you will die in the, we usually put in the patients which are expected to live less than 1 year. And when we put the device, we expect them to live for 15 years. So this is the advantage. It increases survival, it increases functional capacity of the patient, and you don't have to get readmitted again and again for heart failure. So it's basically advantage to the patient is patient becomes clinically better, and it works as like a Tulu pump. That's like when your motor at home is out of order, and you put another motor to work for that, so that your whether your normal motor is working or not, that doesn't make any difference. So the advantages are it improves the clinical outcome, it improves your quality of life, increases your life expectancy. The disadvantage is one is cost, because it's 85 to 90 lakh pump. The cost is high. The another problems are it can thrombose, chances are very less, and it can develop, as patient can develop infection. That chances are very less. We do at our center a lot of this LVAD. I have done from Mayo Clinic and Mount Sinai, New York, where I've experienced more than 100 devices. And when I came to this country, I started this program. And this program, after this program, we could save 9 patients, so those who otherwise would have died. And all the 9 patients are doing fine. There are few patients more in the line we're going to do in next 1 or 2 weeks. So this is one, if your body is not working properly, because the heart is like an engine. If your engine is not good, then there's no point in all the rest of the body. So the advantage with this device is you can live longer with this if your heart is not working. Otherwise, you would die in 1 or 2 years. And your symptoms, once we put the device, your symptoms they go away, because now your heart is working. The another advantage is if normal person like me or you develop a heart attack, we would die. They will not, because they whether their heart is working or not, it doesn't make any difference to them. The disadvantage is you have to charge the battery, keep the battery charged, and you need to replace with time. Because with the development, the initially the battery used to work for 4 hours, then 8 hours. Nowadays, with the newer devices, the battery they work for 18 hours. So you don't have to change them frequently, and you can go anywhere in the world. You can do anything in the world other than swimming, because with the swimming it gets you don't want to submerge the device into the water. That's the only disadvantage of this. Otherwise, you can do any activity, and people would even, if you don't tell them, people would even not know that you are on ventricular assist device. So whichever patient we have put the device, they are quite happy, and believe me, they are much more happier than even heart transplant patients. Because with heart transplant, you have to take immunosuppressions. There are disadvantages of immunosuppression. The another problem in this country is this subclinical tuberculosis. If you give immunosuppression, this tuberculosis can reactivate, and patient they can die. With ventricular assist device, you have to take only one tablet, that's acetylene, to keep the blood thin to 2.5 times the normal, and that's the only thing you have to do. All these patients, they talk to each other, and we have made a LVAD care group. Our patients are in Abu Dhabi, in Iraq, in England, as well as in India. And everybody is so happy with that they always come and told that you have given us a life. They send WhatsApp. We are thankful to the people, those who have given us this year to live and next year to live. So this is basic. It's a breakthrough in the treatment of heart failure, and basically this is the only treatment other than heart transplant for heart failure. If you have more questions, you can go to my website kewalkarishan.com. Thank you very much.